aged care, and since the outbreak began, more than 350 residents in nursing homes have died of COVID-19 in Australia. And now the crisis is playing out in Parliament with calls for heads to roll over the government's handling of this pandemic. Now it comes as a new survey shows more than half of adults with relatives in aged care are considering pulling them out and looking after the loved ones themselves. Well, Ian Henschke, the Chief Advocate for National Seniors Australia, joins us now. Very good morning to you, Ian. This is such a big issue right across the country at the moment. Lots of families, I think it would be fair to say, appear to be losing faith in the system and starting to look at what alternatives might be out there to nursing homes for their loved ones and for the families beyond that.
Yes, indeed, people are losing faith in the system, and I think a recent report which showed that 54% of Australians were considering moving their loved ones out of aged care is very worrying. What we want to do is tell the government to try and get more and more people into home care so that people can be looked after in their home. It's a much better, safer way of looking after older Australians. And we've said this in our federal budget coming up in October. We're saying to the government, provide more home care packages. That's the first thing they have to do. And of course, the other thing they have to do is lower the rate of the pension loan scheme. Now, this is a scheme where older Australians can actually draw on the equity in their home. Well, the government at the moment is charging 4.5% on that scheme, 4.5%, when you can borrow money for a home loan at a bit over 2%. So we're saying to the government, lower that rate. And for people who are worried about drawing on their home, just remember, if you go into an aged care home, you've actually got to sell your home to pay for the deposit. And we know that 80% of 80-year-olds own their own home. So this is an option where the government can help people stay in their own home. And I just want to say one other thing on this. We know that Australians want to do this, and governments should be there to give them what they want. And the aged care industry in Australia is actually very, very... like if there was a world contest for who had more people in aged care, we are the ones that are actually right out there in the front.
Well, our numbers
Australia has the highest rate of institutional aged care in the world, other than two other countries, Portugal and Estonia. So we can do a lot better in terms of home care. It's not the complete answer, but at this particular time in Australia, home care is so important because we're seeing hundreds of people in Victoria die in aged care. We've seen the situation in New South Wales. So National Seniors is saying to the government, at this time of crisis, it's time for you to act. It's time for action.
Gee, that's fascinating to hear you say, Ian, as effectively the vital voice for seniors in Australia. What you're talking there is no small thing. It's effectively a real overhaul of the system and a shift towards home care. And I guess the numbers support it. 350 people have died in these facilities. 120 of them have had coronavirus. You think the time is now for a major overhaul?
It is time for a major overhaul. And I can tell you, those figures from the OECD tell it all. If you look at this situation, Australia has got a very heavily geared system towards institutionalised aged care. And so the government knows this because there are 100,000 people waiting for a home care package. 100,000 people waiting. One of the people that died waiting for a package was my sister-in-law. I had a friend the other day contact me saying his mother had died waiting for a home care package. And the Royal Commissioner's actually said that that this was a cruel and neglectful and inhumane system that we've got in Australia. And I can understand why today, for example, the West Australian Health Minister, I understand, has said, give aged care back to the states because this is actually a health crisis at the moment as well. And you should remember that in South Australia, where I'm talking to you from today, there have been no deaths in aged care. And we've got a very different approach here. If someone gets sick here in South Australia, they are to be taken to a hospital straight away. And we should recognise that in Australia, older people now are going in later and later into aged care. And so, therefore, it's more like a hospital system that we should be working on in aged care. And then on the other side, we should be gearing it so people can stay in their home until those last, or it's usually only the last year or two when they go in. So the budget this year, the federal government must reconfigure the aged care system so that people can stay in their own home. It's estimated by one expert that 1 in 5 people in aged care could be looked after in their home.
It's a staggering number, really. Ian, I'm sorry to jump in over you there. It's impossible to overstate the importance of this, as you've described it, a national crisis. We're very grateful for your time this morning. Here's Mon.